But the minimum loss ratio means that they need to spend that premium revenue. So they have very bad incentives to look the other way on extremely high costs on the other end. So you're getting very inflated costs for high utilizers that benefit providers and big hospital systems. And there's a lot of sort of corrupt behavioral health and addiction treatment services that are taking advantage of that system.
That you have to explain. I think I sort of understand, but that's interesting. Senator Ernst, are you ready to go?
Yes, I sure am. Well, thanks to all of our witnesses for being here today. And this is a really important topic, and I do hope that we can get this government shutdown over and open back up so we can have follow-on conversations regarding this topic. I visit with Iowa farmers every year, what I call my Iowa River to River tour. And I hear way too often about the crushing weight of healthcare costs on farm families. And it's really disheartening to me to hear that, but it's not at all surprising. The Unaffordable Care Act's one-size-fits-none model ignored the realities of self-employment, seasonal cash flow, and the absence of large corporate employers across our farm country. So our spouses, when it comes to farm families, oftentimes they're serving as the family farm's bookkeeper, maybe a mechanic, they're a veterinarian, they're helping with all of the farm activities, all rolled into one. Many of them have been forced into taking off-farm jobs, not for passion, and I love that people are able to pursue their passions, but, in farm country, we do what we need to do to make sure ends meet. And so we have a number of those spouses that have gone to get employment where they have employer-sponsored coverage. That means 40 to 60 hours a week away from the very enterprise they're trying to preserve for the next generation. And this isn't a one-off anecdote. It's reality for far too many Americans, including my own family. I'm in a farm family. My brother is a type 1 diabetic. He had to leave the family farm operation to take employer-sponsored healthcare coverage with his employer. My sister is a type 1 diabetic. She and her husband do our family farming, but she also works a full-time job off the farm to get employer-covered healthcare. Okay, so we do have to make very tough choices. But unfortunately, Obamacare is unaffordable. And because of this horrible system that is out there, some families are not able to choose to do what they want to do, and they've been driven into other opportunities. But Democrats in Congress have branded Obamacare as a chance to bend the cost curve downward, and that's not true. As it turns out, the only thing it's bending is the bottom lines of every farmer, whether they're in Sioux Center or over to Keokuk in Iowa. And the numbers don't lie. Farmers and their families are subsidizing a broken system that doesn't serve them. Rural America needs solutions that don't force spouses to find off-farm work or forego health insurance altogether. Premiums for both plans on and off the exchanges are going up for individuals and small groups, in large part due to the Unaffordable Care Act's many mandates. This is particularly challenging for self-employed folks and small businesses. So, Mr. Blase, if the ACA was supposed to expand choice and lower costs, why are so many counties in Iowa down to just one insurer on the exchange? And why are premiums still unaffordable, even with taxpayer-funded subsidies?
Well, Senator, thank you for that question. And some states like Iowa have taken steps to address problems with Obamacare by opening up like Farm Bureau plans and enabling more people to purchase that coverage that's not subject to Obamacare rules. But the answer to your question is that Obamacare failed. It reduced choices and options for individuals.
Exactly. One insurer. One on most of our exchanges. Mr. White, do you think that having coverage for many farmers in Iowa means that they have access to care?
No, I think getting an insurance card in your wallet doesn't mean that you have access to a doctor or a drug on the plan's formulary. What we're seeing increasingly is these plans are HMOs or exclusive provider organizations, 80% of them on the exchanges. That means if you try and go out of network or get something off formulary, the plan pays $0. That's not access to care. We're paying, like, the premiums now are so high, the deductibles are so high that families are struggling just to meet those obligations, but then they're being massively constrained to the point where they're finding difficulties just going to a doctor or finding a doctor in their area to help them. This is not good coverage. This is really inferior coverage compared to what we see in Farm Bureau plans, in small businesses, and large businesses.
Right. And as the chair had stated earlier, so many of those plans, the high-risk pools, they were all outlawed by Obamacare. I'm also concerned about Iowans being signed up for policies without their knowledge. This is a really big deal. It should be a big deal for every single American that is paying taxes out there. Mr. Blase, I believe you spoke to that. $0 premium plans have enabled those scammers to take advantage. And look no further than enrollment for individual plans in Iowa doubling or quadrupling, depending on the plan type, since 2019. So, Mr. Blase, 9 out of 10 healthcare dollars flow through third-party payers. Do you think this has a role in the levels of fraud and waste that we see in Obamacare today?
Yes, Senator, thank you for that question. The Biden-era COVID expansion of the subsidies led to massive increase in fraud in the program. The availability of fully subsidized plans allowed bad actors, brokers, agents to advertise things like free gift cards, cash, to get people's information to sign them up for plans. Bloomberg did a report on this. They quoted a customer service agent who said half of the people that they were signing up had no idea that they were enrolling in coverage. And the big winners are the health insurance companies. So they're getting monthly checks on behalf of all these enrollees that have no idea that they're signed up for coverage.
Right. Thank you. And I do think this is a real issue, and I do hope we can reopen the federal government. I hope Democrats come along with us and vote yes to open the federal government so that we can have further discussions. But I must say to all of my Democratic colleagues, we need to have a robust discussion about what is wrong with Obamacare. If we truly want to find accessible ways to provide health care to individuals, affordable choices, then we need to identify all of the failures within this system. So then maybe more people can pursue their dreams. But when it comes down to personal responsibility, my family members have had to make that hard choice to seek employer coverage. It is a personal choice to take care of their own families. And I think personal choices then shouldn't be the obligation of the federal government to find ways to fund access to health care. We all need to figure this out. But again, I really appreciate the opportunity to have this hearing today. And I hope that, again, we can open the federal government and have real discussions about these very real problems for Americans as they're trying to access health care.
Senator Hassan.
Oh, thank you, Mr. Chair and Ranking Member Blumenthal. Good afternoon to our witnesses. Thank you so much for being here. I just want to follow up a little bit on what Senator Ernst was just saying, because, of course, Democrats and Republicans want to lower the cost of health care. There is bill after bill filed on a bipartisan basis in this chamber that would do that, including approaches to some changes in the Affordable Care Act. I remember, of course, when the Affordable Care Act was passed, when so many of my constituents in New Hampshire with pre-existing conditions could not get health insurance, full stop, impossible to get. Where people were making the same kind of choices that Senator Ernst just talked about because they couldn't get individual insurance under any circumstances, so they went and took a full-time job or didn't move to a new opportunity because they would have had to wait for a year to get health insurance in that new job. I remember as governor the difference the Affordable Care Act made and has made with Medicaid expansion when people who were chronically ill and couldn't work and therefore couldn't have insurance got insurance through Medicaid expansion, got their diabetes under control, went back to work, and went on to private insurance. That is exactly what the Affordable Care Act has done for tens of thousands of people in my state. And as I hear my colleagues talk, we do need to reopen the government, and we need to take care of a mounting crisis for which we have a very small window to solve, because there are insurance premium bills hitting my constituents' web pages or mailboxes that show them directly that premiums are skyrocketing in New Hampshire right now, both on the Affordable Care Act and on the private market. Open enrollment on healthcare.gov began on November 1st, and I've heard directly from Granite Staters who, when they logged on, saw that their premiums have doubled or tripled for next year. These premium increases are being driven by the Republicans' refusal to extend the enhanced tax credits that help Granite Staters afford their health care. This week, I met Nicole, a mom of 4 in Exeter, who is a full-time caregiver for her children, all 4 of whom have disabilities. Her husband runs his own business. He also has a chronic health condition. So Nicole and her husband get their health insurance on healthcare.gov, and their premium is set to triple in January due to the expiration of the enhanced tax credits. Nicole told me that she does not know how her family can pay thousands of dollars more for insurance next year. And I'll also add that Nicole's children with disabilities have been covered by Medicaid, but because of the changes in the great big bill that was passed in July, 50% of America's children are covered either by Medicaid or CHIP insurance. They are now not sure how her children are going to qualify for health care if some of the changes to Medicaid present barriers for that coverage. My office has also heard from Juliana in Sharon, who runs a small business with her husband and counts on healthcare.gov to get health coverage for herself, her husband, and her 2 children. Juliana is facing a premium increase of $600 per month next year, an increase so large that her family may not be able to afford any insurance at all. These are just 2 stories from the constituents who have reached out and urged me to protect their health care. So as we talk about reopening the government, the Democrats are very clear. We need to take care of these enhanced tax credits. They expire at the end of the year. People are in open enrollment right now. If you want coverage starting January 1st, in New Hampshire at least, you got to choose your plan by December 15th and know whether you can afford it or not. And we know if a whole lot of people drop their health insurance, not only is it devastating for them, but it also drives up the cost of private insurance of those employer plans, because the fewer people who have coverage, the fewer people end up bearing the brunt of the overall health care cost, which in this country is too high, and that is something we should work in a bipartisan way, and there are lots of bipartisan proposals to do that. But that does not change the fact that at this moment, in this country's time, millions of people are facing huge increases in their health insurance bill that is going to further undermine an already fragmented and difficult to navigate and expensive healthcare system and just drive prices up. So when Democrats say we want to do 2 things, we want to reopen the government, and we just want to extend an already existing premium subsidy for a year so we can continue to work on the very issues that I think there's bipartisan agreement that we need to do on. So I just want to lay that out there because we need to reopen the government, but the 2 things, reopening the government and making sure people can afford their health care this coming year at a time when everything else in their life that they absolutely need to pay for, from rent, mortgage, health care, energy, child care, is too expensive. This is a time to address that affordability issue, and we can do it in a way that is a win for the American people while we reopen the government. I did have a question, and I'm sorry I wasn't here when you introduced yourself. Is it Verstegen?
It's Shauna Verstegen, yes.
Verstegen, okay. So Ms. Verstegen, In your testimony, you mentioned your family's experience with Huntington's disease. Some of your fellow witnesses have testified that people simply don't need health insurance coverage. Can you talk about the uncertainty that your family faced before you had insurance options provided by the Affordable Care Act?
Yeah, absolutely. It was a very scary thing for myself and everybody in the Huntington's disease community. One of the decisions we all took in before we decided to test to find out if we had the gene that carried Huntington's was, would we be able to get insurance? And a lot of people decided not to test for the disease because of that fear. Yeah. Luckily, again, because I had the confidence in having the Affordable Care Act, I was able to test, and I did test negative. I did want to point out, and she's not here anymore, but I do wonder, those farm families, I feel like I have a very similar story. Right. And I'm just wondering how it's going to help them to not let them have the expanded premium tax credit for next year as well. We all do need that for our affordable care.
Thank you so much. Thanks, Mr. Chair.
So point of clarity, I don't believe any of the other three witnesses ever implied, much less said, that people don't need insurance. That never happened. The other point of clarification, because I think it's lost, is the subsidies don't go away. Obamacare subsidies remain in place. The way Obamacare was originally designed, up to 400% of poverty level. At most, people pay 8.5% of their income on their net cost, correct? Is that correct? So let's understand that. What's going away are the temporary COVID subsidies that Democrats scheduled to expire. It was a little help during COVID, and it's just going to go right back to Obamacare. If you're complaining about that, again, you're complaining about the faulty design of Obamacare that has driven health care to unaffordable levels. Senator Blumenthal.
And Mr. Chair, I will add that regardless of how we got here, this is where we are. A 60-year-old couple in New Hampshire earning $85,000 a year is going to see an increase in their premiums without the enhanced premium tax credit of $15,000 more a year. I don't know how they make that, and they will end up either bankrupt because of their health condition or just foregoing care, which drives up costs for all of us. I'm sorry to not be able to stay longer. I have to go back to a meeting, but I appreciate this hearing very much.
The first step in solving any problem is admitting you have one. That means acknowledging the damage done by Obamacare. I'm happy to work with you to repair that damage. But if you're not willing to acknowledge it, and all you want to do is throw hundreds of billions of dollars to mask the failure of Obamacare, that's what we're not signing up for. Senator Blumenthal.
Thank you. You know, I'm struck by your story, Shauna, and the choices that you have to make. You're facing $2,400 more per year in health insurance costs, correct? And when do you have to make this decision about what to do?
Well, we're still holding on to a little bit of optimism that everybody can come back to work and come together and help us.
Extend the tax
Yes.
care.
And that truly is the difference between that and my husband putting in his application to Costco in a few weeks.
So the decision has to be made right now. You can't make it.
Yes, we have just over a month.
You can't make it at some point in the future when Republicans get around to providing a health care plan of their own.
And we realize there is a lot to fix, and I truly hope you can all work together to do that. But we're talking about our premiums going up in just a short amount of time. And I know that these problems aren't going to get solved then. So please help us so that we can afford our premiums in 2026.
And the affordability question is here and now, at your kitchen table, in real time. When you go back to Wisconsin, and you face that decision, it's not maybe we'll reform the ACA and, to use the chairman's term, dismantle it and replace it with something else, something indeterminate and right now undefined. You have to make these choices right now. That's what Americans are doing, correct?
Yes, and we have that Costco application on our kitchen table.
And the alternative for you, and I'm quoting you, looking at your husband finding another job, considering shopping for a cheaper plan with a higher deductible, or going without insurance at all? I think I know the answer, but why is that scary?
Well, obviously with 2 children, going without insurance, we talked about it, but then we felt extremely guilty and realized that would not be a smart choice for our family. And we did shop, actually, and and as has been discussed by everybody, we weren't able to find anything a whole lot cheaper. So we are where we are right now, and I wish we could cut more out of our lives, but we've already been working on that. And again, it's not just those healthcare costs, it's our groceries, it's our gas, it's everything going up. So I know it's just over $200 a month, but that does make a really big difference for us, and we're hoping that we can save that.
This morning, I met with a number of Americans from all around the country facing that same decision. I have transcripts of their remarks, including Aaron Lehman, the president of the Iowa Farmers Union. I'd like them entered into the record. If there's no objection. Thank you. I want to come back to something that the chairman said to you before, and I'm quoting him directly, Chairman Johnson, quote, "That is Obamacare's faulty design. It forced individuals like you, individual policies, to bear the full cost of people with pre-existing conditions. Prior to Obamacare, we had something called high-risk pool. It worked great," end quote. Now, Shauna, when you explicitly asked what you would be expected to do if you were diagnosed with Huntington's disease, which is a deadly pre-existing condition, or the people like your mom who have it now, the Republican chairman said, and I quote him again, quote, "We would have done high-risk pools," end quote. These are highfalutin, fancy healthcare terms. So in simple terms, what it means is if you are sick, if you're disabled, if you're dying, the Republican plan is for you to pay more in the high-risk pools. You're grouped together with other sick people, and you all get to pay more. That's what they seem to want to do, which is rolling back. It is regressing to a very dark time in the history of healthcare in this country. I know it well because as Attorney General of the state of Connecticut, I went to bat for people who were denied coverage because they had these so-called pre-existing conditions. I don't want to go back to a time when sick people paid double for their health care, or they went without health care insurance and health care entirely. Can you talk about what that would mean for you or your family?
Yeah, absolutely. I actually, before the ACA, I remember having meetings with our state chapter social worker, the Huntington's Disease Society of America social worker, and discussed the pros and cons of testing and how to go about it. And we looked into options if I did have a positive test, and there was not a single affordable option. In fact, I'm not sure if there were any options for me for that. Like I said, luckily, I did not test positive for that. However, it's very important for me to know for the future of my children that no matter what comes their way, they will be able to have health coverage.
Now, the Trump administration is actually taking some action on health care. It has taken some unfortunate action, which is to increase the potential deductibles. It has issued new rules to increase deductibles. How would that kind of rule affect you? In other words, letting insurers charge higher deductibles as a solution to, quote, improper enrollments. What would it mean for your family if your deductible were to double next year?
That would be a big no, thank you. That is absolutely not help. We do have things come up. We are a healthy family. We have sports injuries and things like that. So having a high deductible does not help the situation at all.
My time has expired.
Okay, some more points of clarification. The ranking member has a tendency of quoting me out of context. I don't appreciate it. I believe when I used the term dismantled, I talked about the way Obamacare dismantled the individual markets and caused, through its faulty design, premiums to skyrocket. When I talked about high-risk pools, I'm sure I always add, they weren't perfect. They would have some modifications to make sure that people with pre-existing conditions were covered. Every state high-risk pool were different. Some worked better. I'm saying Wisconsin, the way it was set up and what it did, it worked beautifully. It worked beautifully. Take a look at the successful models. I think they had a great model in Maine, correct? But anyway, that's Senator Scott.
Thank you, Chairman. So, Ms. Ferguson, what did you pay in 2019? What did you pay a month for your health care?
Just keep asking these numbers. Let's see, 2019. What did we pay? I believe, oh boy. 2019, I believe was
I'll help you out. Our staff
will you help me? You've got the
77,000.
numbers. I believe that was our, before we dropped to a lower tier plan, $1,000 a month, yes. That was
What did you pay in 25?
this past year, $460 a month.
So why should it go down? Did your income go down?
What's that? We selected a lower tier plan. And then we also have the extended premium tax credit that's helping us too.
Okay, and so if the Biden COVID era, what would it go to? If those were extended, what would it go to?
So what would it? Well, I don't know exactly what that would add on, but currently this year we have about $800 in assistance from the extended premium tax credit. So I assume it would help us at least another $200-300 next year.
You don't make less than 400% of poverty, right? Your family doesn't?
No.
Okay. All right, Dr. Blase. So Senator Hassan said that in New Hampshire, I guess, that a family of two, if they, if we don't extend this, a family of two, it just skyrocketed, the premium. So what actually would happen if it was a family of two in New Hampshire? Do you have any idea? Aren't they within 400% of the of poverty and wouldn't? So there's almost no change.
So the underlying Obamacare subsidies, which the chairman said are permanent and aren't going away next year, they are very large. They limit the amount of premium that people have to pay for a plan. So as premiums have skyrocketed over time, the enrollee share has basically remained the same. The vast majority of enrollees are lower income, and they will continue to receive large subsidies next year. So the vast majority of the premium for the vast majority of enrollees will be paid by the federal taxpayer. The most enrollees will pay less than $80 a month for coverage that costs, up to $1,000 a month for single coverage because of the design of the credits. The subsidies in Obamacare only went up to 4 times the poverty line. The idea was that coverage, when they were trying to limit the cost, but those people didn't need subsidies at that level. The problem with Obamacare is it has so increased the price of coverage over time, particularly for older couples, that it has led to very high premiums for them. So they do face higher premiums above 400% of the poverty line if the subsidies expire. But it's a very small percentage of the overall Obamacare enrollees that have that income.
But if you're in New Hampshire, you're making $85,000, you're probably within 400% of poverty, aren't you?
For a couple of two, you're probably just above four times the poverty line.
Okay, so your number's not going to change.
If you're under 400, you will still get a large subsidy. But it's the people just above 400 that are going to face the largest.
Did the Democrats design it that way?
That was one of the main features of the 2010 law, yes.
Okay. All right, why would they do that? I mean, this is their design. They were supposed to, and I assume they were generous and covered the people they thought they had to cover.
In
even excess.
2010, in 2009, President Obama said he would not sign legislation that increased the deficit by a dime. Now, once the law was signed,
Supposed to save like $100 billion?
There were several financing gimmicks. There was a student loan takeover, which has clearly cost money. But what Congress has done is repeal the health insurance tax, the Cadillac tax, the medical device tax, the Independent Payment Advisory Board. Most of the cost savers in the law have been repealed, which leaves just a giant spending
So what's the deal?
provision.
They reduced the cost of Obamacare, didn't they? They wouldn't have reduced the revenue without reducing the cost, would they?
So Obamacare is now significantly contributing to federal deficits, and these COVID-era credits, the Medicaid expansion, because of the bad incentives with states when they're spending and getting $9 in federal money for every dollar of state funding, like Obamacare is significantly contributing to federal deficits and debt.
So, Mr. Bragdon, can you walk us through the fiscal impact of erroneous or fraudulent Medicaid enrollment that stems from Obamacare's relaxed verification standards? I'll just give you some numbers when I was governor. So when I walked in as governor, January 2011, we had a horrible economy. So over 8 years, I worked on, we added 1.7 million jobs. We took the number of people on unemployment from over 900,000 to 61,000 by getting people a job. We reduced the number of people on welfare from over 250,000 to 71,000 by helping people get a job. And I don't know if you know the numbers, but as part of this no verification, this crappy verification, what's happened? I know I think in Florida it doubled, Medicaid population doubled in that time frame. In which, can you talk about the fraud in Medicaid?
Sure. There's two different ways that fraud happens in Medicaid on the enrollee side. You have somebody who's enrolled who's not eligible, and there's a bunch of mechanisms where somebody who's not eligible can be enrolled in Medicaid for a period of time before they're then disenrolled. But you also had, during the Obama administration, you took away states' ability to verify income and eligibility more regularly.
Why would they do that? I mean, that doesn't seem to make much sense. That actually would allow fraud.
It would, because
That
you
was
have,
intentional?
it was, they changed the
It
rules.
was intentional? They wanted more fraud?
Well, there's a lot of incentive for it because a lot of individuals make more money
Why
when they
would-
remain on the
If
program
it wasn't
longer.
to increase the fraud, why would they have done it?
I wonder the same thing.
So can you talk about provider tax, how that is, has cost the federal government massive amounts of money and basically allowed our states to just completely take advantage of the federal budget and federal taxpayer?
So the provider tax is probably one of the craziest money laundering schemes sanctioned by the federal government for states, where states can tax Medicaid managed care plans or they can tax Medicaid providers. Those providers pay the tax to the state, and then the state increases the payments to Medicaid managed care or to providers
Do they get
and
the
draw
money?
down federal money.
Do they get the money back?
They do, and sometimes they get back even more than they collect, both on the provider side and the state side, particularly in Medicaid expansion states, because you have that $9 in federal money for every $1 in state money. So you have these incredibly perverse incentives to launder money from either Medicaid providers or now local governments to send that money to the state for the state to draw down additional federal money and then to use the difference for whatever programs they want and call it general fund money.
Thank you, Mr. Chairman.
Thank you. Okay, more clarification here. We've been hearing premiums double, premiums triple. First of all, do any of you know of any gross premiums that are doubling or tripling? Again, I put up the national average going about 26%. So what we're talking about net premiums, correct? Put this chart back up. I want to just show you this, Senator Scott. And again, trying to use Ms. Verstegen's example here just to illustrate. I'm not saying this is exact, but in terms of the numbers you've given us are this year you're paying $460 net, correct? And you got an $800 subsidy. That means your gross premium was $1,026 or $1,260. Okay? So you can see what the annual amounts in that would be. The other thing you've been telling us is you're going to pay about $700 this year if the enhanced premiums go away or enhanced subsidies go away. So again, we looked at a bronze plan and what's so difficult about this is the premium rates are all over the board for different ages, and, so it's just hard. So you can only take a look at one example, but I think this is, and I'm really asking, our witnesses, does this look right to you then? So if that's what she paid last year and she's going to pay $700 this year, that means her premium, if it was going to go up 26%, it may not because Wisconsin's actually less, but somewhere in the $1,500 range, she'd be getting a subsidy of about $888, so more than she got last year, correct? And on an annualized basis, last year she got almost $10,000. This year she get more than $10,000. So what's going up is her net premium. And I'll keep arguing the reason your net premium is going up is because the gross premium is going up by a grotesque amount because of all the things we're talking about. There's no incentive for lowering costs. All the incentive is for insurance companies to keep raising their premium, and they get away with it because the federal government's their customer. The federal government, and the federal government's got Democrats that are just happy to throw hundreds of billions of dollars at the problem to mask the faulty design of Obamacare. That's what's going on here. So again, both Senator Scott and I, we are more than happy to work with Democrats to repair the damage of Obamacare, move to a system that will actually provide incentives. And that's generally through consumerism, through free market competition. All that's been driven out of healthcare. I mean, one of the things we talked about with Mr. White was the reliance on a third-party payer system. Again, we went from many, many decades ago where patients paid for 80% to now we pay for about 10%. So nobody knows what anything costs, and nobody cares, other than everybody cares about their insurance cost. But when you don't care about the gross premium costs, because the federal government is subsidizing you to the tune of about $10,000 a year. You don't care about that. You don't care that it's $19,000. You just care about what you're paying. And I understand that, and families are struggling. But let's at least be honest in terms of what's happening here. I've got an article just came out today. Again, this is the media putting pressure. Extend these things because there's a couple. Apparently, I'm not sure this person actually exists. 60-year-old couple making around $85,000 in Barron County could see premiums skyrocket over 800% with an annual increase of $33,000 in costs. And I went, that's just not possible. I mean, but it is. That's what the premium is for a 60-year-old couple. $33,000. Now, it's going up that much because they obviously make more than 400% of the poverty line. And this is a couple, I don't know, we'll assume one of the reasons they thought they could retire, because they're retired. They don't get it through the employer. So these enhanced subsidies incentivize people to retire early, knowing they weren't going to have to pay much for health care. They weren't looking at the way the Democrats designed those enhanced premiums to expire, and that they weren't going to be able to afford the unaffordable Obamacare. But just speak to that incentive, because we've heard this time and time again, and I think it was Dr. Blase or Taryn talk about it's a kind of small group of people that aren't eligible yet for Medicare, who retired early, relying on those enhanced subsidies, and when they go away, because they make more than 400% of poverty level. Again, Obamacare was designed not to provide any subsidy to anybody making more than 400% of the poverty level, which is, I don't have that number, but what is that for family? It's like $123 a year, isn't it? For an individual, it's like 60 some?
Yeah, 123,000.
So if you're making more than $120,000 under original Obamacare, you didn't get any subsidy under the enhanced subsidies, sky was the limit, basically.
Yeah,
right?
I mean, there was a news article a couple of weeks ago about an early retiree couple. They'd worked in government for 30 years. They had a $140,000 pension, and they, because of the COVID credits, qualify for a $15,000 subsidy now towards their health insurance. There's no asset test on these subsidies, right? You can have unlimited wealth and qualify these subsidies. It's based on income. Enormous incentive for, particularly if the enhanced subsidies are continued, for couples to retire early. We're also seeing big incentive for cities and states to dump their retiree
I want to
health
talk about
plans
that, yeah.
into the exchanges. So the Wall Street Journal had a piece discussing how Detroit and Chicago had offloaded the cost because it was underfunded retiree health plans onto the federal government through the exchanges.
I think they call them the Blue City subsidy.
Bailout.
Well,
And I'd say so the market in 2013, the individual market was unsubsidized. In the pre-COVID credit era, the market was 75% subsidized. Now it is approaching a 90% subsidized market. There are alternatives. So when I moved to the state of Florida 5 years ago, I looked at Obamacare plans. Obamacare plans, when I called the doctors asking about the plans, they just equated them with Medicaid because they have such bad networks. I then looked at short-term limited duration insurance, which is a policy a plan that the Trump administration had opened up for 3 years, much more flexible, covers a far broader set of providers. I was able to get my family on a short-term limited duration plan with basically a comparable deductible, much broader provider network for 1/3 the cost of what the Obamacare plan would be. So the point is we need more competition, we need more options. Unfortunately, the Biden administration has restricted that ability to access it. So people don't have options other than this one market where the government is dumping all the subsidies into it.
again, I bought healthcare for my business for 30 years. And every year you'd have to negotiate. You'd have a number of carriers coming in. I mentioned that one year somebody came in and offered us zero deductible plans. Like, great. I mean, at the same price we were paying, I think back then we probably had $150 deductible, out-of-pocket maximum for a family, $1,000. Again, I don't remember the exact, but I mean, that's the levels we were at. When I left, I really do not believe I ever had for one of our health plans more than an out-of-pocket maximum than $5,000 for a family. I could be wrong, but that's about where it was. Then I hear Ms. Verstegen here with a $14,000 deductible. Again, those were the catastrophic plans that didn't cost like anything because it's not insurance. So again, I am more than happy to work with anybody who's willing to acknowledge this reality. Again, you cannot solve a problem unless you first admit you have the problem, then you have to properly diagnose it. You got to do root cause analysis. This is what's driving insurance premiums up. You don't mask it. Again, when you've got a crumbling structure, you got rusty beams, you don't paint over it and then move in. You replace the beams. I mean, there's something structurally wrong here. And there's something really structurally wrong with Obamacare. So it's not like we don't have hearts here. I feel a great deal of sympathy for all of the victims of Obamacare, and there are a lot of them. Okay? I'm happy to provide some kind of bridge for people that, again, had no options. You have no options because of Obamacare. So it's going to take us a while to transition to a system that works. I'm happy to do that, but I'm not going to do it with folks on the other side that, again, take your comments out of context, just absolutely refuse to admit that the structure of their Obamacare is flawed, faulty, causing all this. Now, if they're willing to look at reality, do it like a business person, go, okay, yeah, we kind of blew that. Let's clean up this mess. Happy to do it. Happy to do it once they vote for a clean CR and open up the government and not hold government employees and the American population hostage. They've taken their own family member hostage. This is the most bizarre thing in the world. They're the party big government, and they've got the gun to the big government's head, and this is the most bizarre Kafkaesque type of situation we're in right now. But again, I'm happy to reopen the government and then sit down in good faith because I feel sorry for the Verstegens. I feel sorry for I feel if this couple, I feel sorry for these people. I would like to help them. But throwing $500 billion at the problem won't help them. It will not fix the structure. We'll have to be throwing more money next year and then more money. Doesn't fix the problem. Admit you've got the problem. Admit you blew it. And work in good faith to fix it. Senator Blumenthal.
Thanks, Mr. Chairman. Those millions of people who've been harmed by Obamacare, I don't see any of them here. I don't know of anyone who has been harmed by Obamacare. The title of this hearing is the damage that's been caused by Obamacare. We don't have any damage to any individual who has Obamacare or the ACA, except for the people who are going to be paying higher premiums right now. And to bring it back to the real world, Shauna, you're going to be paying more for health insurance next year, correct?
Absolutely.
$2,400 more because the tax credits, the health care subsidies, are going to be blocked by Republicans, correct?
Correct. And it was said that I am limited in my options now or don't have any options with the Affordable Care Act. I didn't have options before the Affordable Care Act, and now our family does have a lot of options. And people keep saying there's nothing they can do, but there is. If we have those extended premium tax credits, that will help. I'm not saying that's the only thing that can be done, and I'm sure you can all work this out. But in just over a month from now, that's what our family needs.
That's the real world right now for you, and it's the real world for a family in Connecticut earning $66,000 a year, which is 205% of the poverty level, and their premiums will increase by $3,000 per year. In Ohio, a family of four making $72,000 per year will see their rates rise by more than $3,500 annually. That's akin to giving the parents in those families a massive pay cut. And correct me if I'm wrong, that increase in premiums will come on top of rising costs for groceries, for housing, for electricity, correct?
Yes, all of our costs are going up. Yeah, housing, electricity, sporting events.
It's not just a healthcare crisis, it is an affordability crisis that will be aggravated significantly if these healthcare tax credits are not extended. You know, I want to ask you, again, coming back to your personal situation, how did you happen to become an advocate for affordable healthcare?
I remember how helpful these extended premium tax credits were. Before they were there, we were having lots of discussions again on what to do. And I remember when the administration turned over, the first thing we said was, oh, I really hope we don't lose these tax credits. And when we learned that we might, I had a lot of friends discussing over what's going on, why is the government shutting down? And I did a social media post. I said, here I am. Here's somebody who uses the Affordable Care Act. Here's why my family needs it. Here's why my family needs these extended premium tax credits. And again, I think it's through telling stories. I think everyone has a vision of who is using / abusing the Affordable Care Act, but it's us, it's me.
And in your own family, your two children and your husband, I assume, share your passion for outdoors and sports and so forth. And sometimes things happen, broken bones and stuff like that, correct?
Yes.
And that's part of the reason why you can't take the risk
Absolutely not.
of not having health insurance.
We don't want to have to make those decisions.
Mr. Chairman, one of the witnesses, I think it was Mr. Blase, mentioned the Paragon report, which I think it has been established relies on double counting, partial year enrollments, healthy young people who happen to go a full year without going to the doctor or falsely conclude that real people are engaging in fraud. I have a number of analyses of these reports, and without objection, would like to submit them for the record. There are 3 articles that describe these and other reasons why the Paragon report conclusions are wrong, as well as a recent federal district court opinion that described the Paragon research as, quote, data of questionable validity. They are a KFF article, Kaiser Family Foundation article, an AHA response, Keep Americans covered response, and City of Columbus court decision.
Without objection, you'll, of course, have a chance to respond to that.
I'm sorry, were they entered into the record?
Without objection, I just
Thank
said Mr. Blase have a chance to respond to that.
Well, I don't mind him responding.
No, I mean, I'm in terms of bringing things to the record.
Okay.
So I think we did multiple reports this year and last year looking at improper and phantom enrollment, zero claim enrollment in the exchanges. One report last summer called The Great Obamacare Enrollment Fraud, and then a follow-up. It was very simple analysis. We just compared the number of enrollees who signed up claiming an income in a category that qualified them for a fully subsidized plan with the number of people from the Census Bureau that have income in that category that don't have other sources of coverage like Medicaid or Medicare. And it is a stunning number of people enrolled in that category who don't have that income level. And that's the report that we found in 15 states. There's more than twice as many ineligible enrollees. And the criticisms of that report are really they're laughable. They say that we can't bring data from one year to the next, but that is done routinely because Census Bureau data wasn't available for the same year, so we just needed to make slight adjustments to go from 2024 to 2025. The second set of reports you're referring to is our analysis of zero claim enrollees. In August, so if you have a lot of improper enrollees, we then expect, well, many of these might not be using any medical claims, and CMS in August released data of the number of enrollees who signed up at any point in time during the year that used no medical services. And in 2021, it was less than 4 million people enrolled in the Obamacare exchanges that used no medical services. In 2024, that had increased to almost 12 million people. So that's publicly available data. Your staff, they could run those numbers. And one of the issues was we couldn't identify, and this is from the data, whether people were enrolled for the full year or for the partial year. We presented that finding. That's the same limitation that was in prior years. But if you look at the total market, it was 35% of all enrollees that used zero medical claims in 2024. It was 40% in this fully subsidized category. And in the normal insurance market, you would expect that to be about 15% of enrollees that didn't use any medical claim. But all of the data is publicly available, and we clearly stand by the research.
Okay. I think I have a couple of minutes left on my round.
Go ahead.
Thanks for that explanation. I just want to reiterate that reforms are easily within reach. I hope that my colleagues will join me in the measures that I've proposed to eliminate abuses in the Medicare Advantage area, more power for negotiating drug prices in the Medicare program, and one other, which I think is very important, giving patients the power to walk away from their private insurer and join Medicare. If we don't want to line insurers' pockets, I'm hopeful that my Republican colleagues will join me in legislation that would give patients that power, and to oppose the administration's steps that only serve to increase the cost of health care, which in fact would allow insurers to charge families more and increase their already too high deductibles. I think I'm pretty much out of time on this round.
Okay. Kind of hard to fix something when you're in a constant state of denial, almost total state. I mean, the ranking member apparently just does not want to acknowledge the fact that you have prosecutors prosecuting people for these phantom policies. So it exists. It's difficult to come up with a definitive number because you have to make estimates off of trends, that type of thing. But 6.4 million sounds like a reasonable number to me when you've gone from, what, 4 million to 12 million people that have made no claims against their policy. But he also stated that there are that nobody harmed by Obamacare. There's no victims. There's an excellent article in the Wall Street Journal talking about written by a father with a 17-year-old severely autistic child who, God bless his family, they're taking care of him at home. They were just hoping for home health care. They were on a 10-year waiting list because they were being crowded out by those single-age medical expansion beneficiaries of Medicaid. That's a 17-year-old, that's a family being harmed by Obamacare. What about all the employees that have been thrown off of employer-sponsored care because the employers are incentivized? So I got an alternative for my employees, boom. You can take advantage of the wonderful Obamacare exchanges, which Ms. Verstegen took advantage of. Again, she's a victim here. In 2019, she was paying $1,000 a month. $1,000, to me, when I was buying, that's an absurd level, $1,000 a month. Okay, she couldn't afford it, so she had to go to a Obamacare policy that she could afford at $250 a month with a $14,000 deductible, and she and her husband had to take out an $18,000 home equity line of credit. Again, I feel sorry for you. You are a victim of Obamacare. There are a lot of victims of Obamacare, okay? There's been a lot of damage done. I think we've done a pretty good job laying the case out. Now, you can deny it, and we'll never fix the problem. You can keep throwing money at it, and you create more victims as we completely bankrupt this nation, spending money we don't have. Or you can actually sit down in good faith, like a business person would do, and go, yeah, this isn't working so good. Okay, what are the problems? What do we need to fix? What caused premiums on average, state by state? 169% increase over 2013 versus 39% inflation. What caused that? I think we know. Won't get it perfect, but I think we know. So again, I'm happy to work in good faith, but I mean, until we get people on the other side of the aisle that are willing to admit what a miserable failure Obamacare is and what the structural reforms need to be, again, I'm not going to sign up with throwing hundreds of billions of dollars more to just paint over the rusty structure. So if you want to respond, go ahead.
Yeah, thank you, Mr. Chairman. I'm hardly in denial as a former prosecutor about the presence of wrongdoing and fraud that may exist in this program or any other government program. I have prosecuted cases of fraud as a United States attorney, and I have sued pharmaceutical drug companies as Attorney General for violating the antitrust laws in many of their practices. And if the chairman is really serious, please join me, and Republicans, please join us in the Insurance Fraud Accountability Act to impose criminal penalties on the brokers who engage in deceptive marketing or enrollment practices that may lead to the abuses he has just described. I know as a prosecutor, laws are dead letter if they're not enforced. And dismantling Obamacare is not going to cure the problems of human greed that lead to abuses of any government program. So I hope he and Republicans will join me in that effort and the other reforms, which could be done during this session before we do another great, big, beautiful, blatant betrayal, and before people lose Medicaid, and before we have the increase in premiums that real-life Americans are going to see in real time, even as they see also the increases in rent and electricity and food that make life increasingly unaffordable for them. And I am sure this debate will continue, and I hope to make the most important point of all, which Shauna really made so well. This is not a Republican or Democratic problem. It should be bipartisan. Healthcare should not be about red or blue states or political affiliations. And I hope we can move forward and come together as a nation to improve Obamacare, but not throw it out. That's the last thing in the world we need. Throwing out the Affordable Care Act is not what Americans want. It's not what they deserve. It's not what we should even raise the specter of having happen in the greatest country in the history of the world. Thanks.
Well, vote to open up the government. We sit down and talk. Not going to get very far if the only solution is throwing hundreds of billions of dollars at it or some other Rube Goldberg types of solutions that won't work. But appreciate the witnesses. Again, thank you for all your time and effort. The record for this hearing will remain open for 15 days, 5 p.m. on Friday, November 21st, 2025, for the submission of statements and questions for the record. This hearing is adjourned.